country, we are seeing more COVID-19 cases and more deaths. Most states across the country are allowing some of their businesses to start to reopen. NBC's Chris Pallone tells us how owners are trying to figure out how to balance safety with service.
Yeah, I got to take this off the talk now. I'm serious now.
In Phoenix, Larry White Sr. of the iconic Mrs. White's Golden Rule Cafe has some strong thoughts about the state allowing restaurants to reopen their dining rooms to customers.
All the money's gone. But I tell you one thing, I ain't going to open up the Disneyland open up.
It's a dilemma business owners across the country are wrestling with. Just because they can open up again, should they? By the end of this weekend, 48 states will have begun easing COVID-19 related restrictions on people and businesses, even though just 9 states have reached recommended testing levels to reopen.
What I'm worried about is that those states are really playing with fire, that they might have big outbreaks, and in the worst case scenario, may have to shut down again.
The name of the game is definitely adapt, adapt, adapt. And it does get hard every day, every week to have to be figuring it out. But we're going to all do the best we can.
Some cities closing streets and letting businesses set up outside.
That allows us to have the space necessary to do what's required, which is, distancing.
The CDC predicts the number of dead from coronavirus will reach 100,000 by June 1st. But it's clear cooped up Americans are eager to get out, and business owners want to stop the financial bleeding.
As a business owner here, a small business owner, it's my duty to not only put food on the table of my own family, but on the tables of my 230 employees as well.
Restarting the economy too soon or not soon enough? More uncertainty in the age of COVID-19. Chris Pallone, NBC News, New York.
Here in Indiana, more than 27,000 Hoosiers have tested positive for COVID-19 and nearly 1,600 have died. Marion County had the most new cases again with 164, but the good news is fewer people across the state are going to the hospital for COVID-19. Right now, some Indiana hospitals are helping find the best way to treat coronavirus. Early studies show the drug remdesivir can help, and IU Health is taking part in several trials.
Currently, we're treating everybody with 10 days of remdesivir, but if you could treat it with 5 days treatment course with the same efficacy and safety, then obviously that's a benefit and could double the drug supply.
120 sites around the world are involved in this study. Right now, the drug is not being offered to everybody, but state health leaders say it is becoming more widely available. And what about garage sales? It's a popular weekend activity, especially now that the weather's warmer. Well, the state health commissioner was asked about this and says it is safe to have one or shop at one as long as you follow social distancing guidelines.
I don't think if you're in a risk category, like someone who's over 60 or 65 or has underlying health conditions or is immunocompromised, that you should be having a garage sale. But secondly, if you do go to garage sales or if you have one, please wear a mask. Please have lots of hand sanitizer out and available for people. Please wash your hands frequently and make sure that people social distance. People need to park separated and they need to stand separated, and you would be in charge of enforcing that in your neighborhood or at your own home.